I want to talk to you a little bit about what are called flap surgeries for breast reconstruction. So a flap means a piece or chunk of tissue that is brought from somewhere else on the body that is then used to add volume to create a breast mound. So typically there's ones that are attached to their blood supply, and then there are ones that we detach from the blood supply to move. And so free flap is one that's detached, and that typically is a very common one is one that's called a deep flap, which is the lower belly tissue is teased out with the blood supply through the muscle. That gets detached, brought up to the breast, and then reattached to a blood supply, which is a very complex surgery, very involved, lots of time in the operating room setting. People usually spend about a week in the hospital, so very involved surgery. There are centers that do that. Our offices aren't doing that here at Springfield Clinic at this time, so something that obviously you want to know about and be able to investigate if you feel like that's something that you're interested in. The surgeries that we do with the flap tissue would be either what's called the latissimus muscle, which is a big V-shaped muscle in the back. We can take that muscle with some skin and fat over the top of it, so there's an incision that goes across the back, kind of similar to the bra strap area. And that blood supply comes up through the armpit, and so like a pendulum, we can take that tissue and swing it from back to front underneath the skin that then adds volume to create a breast mound. When harvesting that muscle, there is about a 9% to 10% function of that muscle that attaches to the upper extremity. And so there are good studies to show that with removal of that muscle, that there's not a big discrepancy or loss of function with the arm movement. People who may notice it would be people who are professional rock climbers, rowers, someone who's very active and may notice a very small loss of function, but typically people with therapy at a minimum or even without therapy can recover and have no limitations after that muscle has been released in the back. On the back, we do notice some flattening of that area because we are taking out some skin and fat with that. You'll have a scar back there. There can be some numbness around the surgical site. And one of the complications we worry about is fluid collecting underneath the skin. We definitely put a drain back there, but may also need to draw fluid if that would accumulate after the drain is placed. And that can be done in the office setting typically. Rarely do we put a drain back in that area if there's more fluid that's continuing to reaccumulate. But those are some of the kind of trade-offs of doing that procedure is another surgical site and some potential complications. So a tram flap is a chunk of tissue from the belly area, and typically we would do this for unilateral breast reconstruction. We don't want to do a tram flap for both sides because when taking the tram flap, we're using the abdominal muscle or the six-pack muscle to be part of the muscle and tissue that's moved because the blood supply runs through that muscle. So if we would harvest it from both sides, now we're weakening the abdominal wall and can cause bulging or hernias, and so we don't do both-sided tram flaps to do breast reconstruction for both sides. So typically we're going to use a tram flap for one-sided breast reconstruction. That tissue is kind of like if a tie is attached here, you're going to take the tissue and kind of roll it up to bring that tissue up underneath the skin and create a breast mound in the pocket where the mastectomy is done. The nice thing is it's your own tissue that can be used. Some women don't mind having some of that extra tissue removed from the lower abdominal area. Aesthetically, it's not the same exactly as a tummy tuck procedure, and there's some weakening of the abdominal musculature, which we would need to discuss with you and kind of go through that in more detail. But it is a good procedure to harvest your own tissue and do a reconstruction on one side. Some downsides of that are what's called fat necrosis. The blood supply to the fatty tissue that's brought up sometimes is limited, and the response of the body is something called fat necrosis, which is firmness of the fatty tissue. Typically over time that will soften and become less firm. Rarely do we have to go back and remove some of that fat necrosis tissue, which can obviously affect the outcome or the cosmesis. And so something that people will notice sometimes with that procedure is some of that firmness of the fatty tissue.